What does a heart attack actually feel like? For some, it's a crushing pain in the chest. For others, it's just some discomfort in the arm or jaw or no pain at all. And yet, heart attacks are the #1 cause of death worldwide. Today, we're going to explore why heart attacks happen, how your heart works, what leads to the sudden blockage that causes one, and most importantly, how to avoid it. Your heart is a muscular pump about the size of your fist. It beats around 100,000 times a day, pumping blood through a network of arteries and veins. But here's the twist. Your heart needs its own blood supply too. That's where the coronary arteries come in. These are small blood vessels on the surface of your heart that feed it with oxygen and nutrients. If anything blocks these arteries, just like clogging a pipe, your heart can't get what it needs. And that's when trouble starts. So what causes the blockage? It's a slow, sneaky process called atherosclerosis. Here's how it works. 1. Tiny injuries or inflammation inside the artery walls caused by things like high blood pressure, smoking, or high cholesterol create rough patches. 2. Your body tries to heal those patches by sending cholesterol-rich particles to the area. 3. Over time, these build up into a plaque, a mix of fat, cholesterol, calcium, and other substances. Now imagine this happening in your coronary artery. The plaque narrows the passageway, reducing blood flow. You might not notice it right away, but your heart is working harder with less oxygen. That's already risky. But here's where it gets dangerous. Sometimes a plaque ruptures, it breaks open. When that happens, your body thinks there's an injury, like a cut. So it sends platelets to form a blood clot. The clot can completely block the artery in minutes. And that's what causes a heart attack. Medical term: myocardial infarction. Moy muscle, cordial heart, infarction, tissue death from lack of blood. When the blood flow is cut off, the heart muscle cells begin to die. The longer the blockage lasts, the more damage occurs. Most people think of a heart attack as chest pain, and that's common. But symptoms can vary, especially between men and women. Classic symptoms: 1. Chest pain or pressure. 2. Pain radiating to arm, neck, jaw, or back. 3. Shortness of breath. 4. Cold sweat. 5. Nausea or lightheadedness. In women, symptoms can be more subtle. 1. Unusual fatigue. 2. Indigestion, like discomfort. 3. Pain in the upper back or jaw. And sometimes, no symptoms at all. This is called a silent heart attack. WHO's at risk. You might be wondering, am I at risk? Here are the major risk factors. High blood pressure. It makes arteries more vulnerable to damage. High cholesterol, especially LDL, the bad kind, it contributes to plaque buildup. Smoking toxins damage blood vessels and increase clotting. Diabetes, high blood sugar, harms your arteries. Obesity and lack of exercise, more weight, means more strain on your heart and higher chances of inflammation. Family history. If heart disease runs in your family, you're at higher risk. Age and gender risk increases with age, and men tend to have attacks earlier, though heart disease is the #1 killer of women too. The good news: most heart attacks are preventable. Know your numbers: blood pressure, cholesterol, blood sugar, body mass index. Eat heart healthy. Think Mediterranean diet: lots of fruits, vegetables, whole grains, healthy fats, and lean proteins. Exercise just 30 minutes a day, 5 days a week. Walking counts. Quit smoking. After just 1 year smoke-free, your heart disease risk drops by half. Manage stress. Chronic stress increases inflammation and blood pressure. Deep breathing, meditation, and social connection can help. Sleep well. Poor sleep is linked to higher risk of heart disease. If someone is having a heart attack, every minute counts. Here's what to do. Call emergency services immediately. Chewing an aspirin helps thin the blood. Stay calm and keep the person still. Use an AED if available if the person collapses. Never wait to see if it gets better. The faster you act, the more heart muscle you save. Conclusion: heart attacks don't just happen out of nowhere. They're the result of years of silent changes inside your body. With the power to stop them, that's in your hands. Know the risks. Listen to your body and take care of your heart, because it's been taking care of you every second of your life. If you learned something today, share this with someone you care about. You might just save a life. Thanks for watching, and take care of your heart.